Welcome, everyone, to today's broadcast, What It Means to Be a Mindful Parent. My name is Dr. Gregory Leskin. I serve as Director for Military Families for the National Child Traumatic Stress Network. It's a great pleasure to be here today.
Hi, I'm Julia Yeary. I'm the Director of Military Family Projects at 0 to 3, and I'm also very glad that you're joining us today. During our vodcast on February 25th, we talked about dealing with your child's big emotions and emphasized how being mindful can really help. Well, today we want to dive just a little bit deeper into mindful parenting practices and provide you with some strategies that we hope will help to ease some of the parenting stress you may have been feeling lately, and will also support the amazing work that you've been doing supporting your child during this pandemic. Mindful parenting has always been around. However, recently it's been talked about a lot more, and really the researchers have been doing a lot of work helping us to better understand it. What the research is telling us is very encouraging. The studies that have been done on mindful parenting and mindfulness-based interventions have consistently demonstrated benefits both for the adults and the children in their care. While more research is always needed, we do know that using mindfulness parenting practice leads to an increase in positive parenting outcomes, resulting in greater support for healthy child development and outcomes. Researchers have also found evidence that mindfulness practices during pregnancy can actually decrease reports of postpartum depression. All caregivers, mothers and fathers, have reported a reduction in their stress levels in that period right after the birth of a new baby when they've been taught mindful parenting techniques. And the evidence also indicates that parents of children who have a special need have benefited from a mindful parenting practice. They report a reduction in the stress and anxiety and greater parenting satisfaction. So check out this report by Mira Gell, Kathy Kinsner, and Rebecca Parlakian that you see on the slide. It can really dive a lot deeper into your understanding of mindful parenting practices and really provide a lot of strategies. So exactly what is mindful parenting? Well, it's paying attention to what's happening in the moment and accepting that those experiences are there and they're real, and we really don't need to judge what we're feeling in the moment. It sounds kind of easy, but you know what? It isn't always so easy. There's so much that gets in the way of being fully present and in the moment. Our brains are constantly judging, and probably what we're doing is judging ourselves as parents more than anyone else is judging us. 0 to 3 suggests 5 ways to be mindful as you go about your day and help bring this practice into your everyday moments with your kiddos. First, really try to practice listening to your child with your full attention. Sometimes this is hard because we have other things on our mind, like getting out of the house on time so you can get to work without being late again, or maybe it may seem harder because we want to try and listen to your child, but we're also like getting text messages and trying to respond to people, especially if we're trying to like work at home and care for our children at the same time. Again, there's so much that can get away. But we want you to try and listen to what your child, no matter what their age is, what they're trying to tell you by paying attention to, again, what their behavior is saying, not just their words, because their behavior really is the key to understanding your child. Next, we really want you to try and accept both your child and yourself without judgment. Yeah, that includes those feelings that aren't so fun to have, like guilt and impatience. By understanding that parenting is hard work and exhausting, and by accepting all of your feelings and all of your child's feelings, you can start to move from the feeling brain to that thinking brain we talked about on February 25th and respond to the moment rather than reacting to what you're seeing happen in front of you. It really helps here to understand what your child can do developmentally. So if you have a little one, we recommend you check out 0 to 3's website to learn more about early child development, what you can expect when. Next, we really want you to use your imagination and try and figure out what might your child be feeling? And really try to put yourself in that frame of mind of what your child is feeling. Sad, lonely, angry, rejected, confused, frustrated. Try and figure that out. And then by putting yourself in your child's place and imagining what they might be feeling, that really helps you to tailor your response so it is full of love and compassion for your child while still maintaining the boundaries that your child needs. This is going to help boost your child's social emotional skills too, when you can help them understand what they might be feeling. Now, this next one is going to be really important, and you've heard it stressed in many of the talks that Greg and I, Dr. Leskin and I have been given, and that's that your child will only be able to match the level of calm that they see in you. So it's really important to practice managing your own feelings and your own reactions. Take the time you need before responding to a challenging behavior by taking a few deep breaths, taking that pause, or even take a grown-up timeout if you need it before responding. And later on in this podcast, we're going to actually talk to you about one simple mindfulness technique that you might be able to use. The last step is so very important. Show compassion, both for your child, but for yourself. Remember that children are trying to figure out how to navigate this big world, and they need your support to learn how to problem solve and how to manage their emotions. This is hard work, and everyone, even therapists with years of experience, find at times that they react in ways that they just aren't proud of. So remember to be kind to yourself and to your child. We learn from our mistakes, and we try whenever possible to take that pause we need, take a breath so that we can reset and then respond in a way that is mindful. There's a reason why we call this practice.
Right. Parenting a tween or adolescent can be challenging for many reasons due to the rapid growth in emotional and physical maturity that occurs during this period of development. Parenting your teen during COVID-19 restrictions has made parenting adolescents even more challenging, as there have been real limitations on your teen's ability to directly experience and express this newly developed sense of autonomy. Some parents have been describing that their teen feels like they've missed out on very important activities at school, sports, and other social activities that they were looking forward to, but ended up missing or having to experience virtually rather than in real life. Hopefully, as a family, you've been able to recognize and discuss these missed experiences. Find ways to talk about and support your teen if they've missed out on things that they were especially important and looking forward to, including naming and acknowledging those disappointments or frustrations. Taking a mindful parenting approach is critical to helping to establish and maintain a healthy environment for teens to share difficult emotions, as well as to support development of their adult self-image and relationships. I'm going to share some important considerations for parents of adolescents to focus, with the goal to help parents to stay more cohesive, flexible, and calm, working together to find balance within the family with an aim to build cohesion and flexibility into that dynamic is considered a protective factor well suited for adolescent mental health. Having family cohesion allows adolescents to disclose more negative emotions with their parents. It is also so important to allow adolescents the opportunity to share negative emotions with both parents. Family cohesion means that family members feel close to each other and that they can rely on each other to talk about and receive support during times of stress, transition, or change, as well as those times teens might feel moody, irritable, or withdrawn quite naturally. Flexibility suggests that parents are willing to work together to compromise with each other and their teens, to make changes and allow for accommodations that allow for the burgeoning growth of their teen, including their opinions and new interests while maintaining family norms and values. Finally, calm is so essential, and it really refers to the family's goal to communicate emotional expression, including strong feelings, in appropriate ways so that others can hear and understand each other. For a parent, staying calm means knowing that your child may be experiencing a painful, difficult emotion and being able to listen intently and stay present for them and helping to not escalate or become upset. This skill will allow for the greatest amount of emotional disclosure by your teen. By doing this, you will create an emotional safety net for your child to feel safe, to completely share and experience their complex feelings. In addition to family cohesion and flexibility as keys to the family dynamic, these will help maintain the mental health and well-being of your teen. Parenting-focused mindful interventions have been found to reduce stress and improve a sense of calm, flexibility, and greater family cohesion, as well as parent-teen relationships. We would recommend incorporating mindful exercises into daily practice. It can also be helpful to introduce these practices with your adolescent if they're interested in joining. How does one begin a parent mindfulness practice? Well, you can practice some gentle yoga or do a body scan or meditation or breath work or relaxation methods. All of these can be very helpful. Mindfulness incorporates a sense of deeper appreciation and immersion into a present centeredness, into the moment. The raisin exercise is also a well-known mindfulness exercise, and you can find the link to the raisin exercise here. This is a 5-minute mindful eating exercise just used to introduce people to the mindfulness approach. This exercise allows you to practice holding, seeing, touching, smelling, and tasting a raisin. This is an especially good exercise to practice, especially if you're finding you are interested to begin or find a place to start mindfulness practices. Start with a raisin and move on to other objects or nature or anything else that you would like to develop a deeper connectedness with. I would also recommend Tara Brock's Loving Kindness Meditation podcast, available here at tarabrock.com. I will listen to Tara Brock's meditation whenever I need to find a calm place to address difficult emotional issues and communicate from a place of acceptance and forgiveness.
I'd like to walk you through a mindfulness activity to practice self-compassion. You can find this in the steps that I talked about earlier today in the article on our 0 to 3 website that we gave earlier. This particular activity is especially useful in a moment of stress or when you find yourself really judging yourself and that's coming out to the surface. Right now, I'd like you just to imagine a time when perhaps you were very self-critical and see if you can't do this exercise with me right now. Right now, just kind of get comfortable in your chair, and we're going to start with taking a deep breath and exhaling really slowly. So take a deep breath and then very slowly exhale. I find it helpful to close my eyes or soften my gaze by looking down slightly. What I do then next is really to acknowledge and name the emotion you're feeling. What is this feeling? What is this tenseness that I'm feeling? And then notice where it might live in your body. Is there any tightness or any discomfort? Where is that? In your shoulders, in your stomach, perhaps in your face, in your jaw? Where might you feel this tightness? Now place one or both of your hands on your heart and take a deep breath and a long, slow exhale. Intentionally bring kindness to yourself. You might imagine a soft golden light that fills your chest as you breathe in. And if this is difficult, imagine how you might comfort a dear friend who is suffering and turn that nurturing support toward yourself. And take a few more breaths with your hand on your heart. And then continue relaxing as you open your eyes. This exercise is something you can do in the moment. You see, it just took a short amount of time, and it helps to take you from that reacting to what's happening to really pausing and calming your whole self-regulation system so that you can then really be present for your child and then think about what is going on with your child's behavior so you can respond appropriate to what your child is expressing through their behavior.
Please feel free to remain in your calm place as we finish our presentation with some additional resources. There are several excellent materials for kids and teens to learn about mindfulness too. We're going to share some of those with you now. Here's a great video for younger kids that we'd recommend on YouTube. Sesame Street has some great videos like Count, Breathe, and Relax. All of these very good to work with your kids and show them how to acquire these skills. And for all kids too, mindfulness.org, learning mindfulness activities can be very helpful to help your child to remain regulated and calm too. Today we discuss mindful parenting as a way to help parents stay calm, thoughtful, and present for their children and teens, especially during emotionally difficult or turbulent times. These are also great activities to practice every day for 5 minutes to help you to deal with stress and work-home pressures and demands. This may be a very difficult time for some people, including children. If you or your child is experiencing mental health problems, such as ongoing stress, anxiety, depression, or loneliness, we encourage you to seek out professional counseling through behavioral health or a military family life consultant. If you require assistance, feel free to call Military One Source at 1-800-342-9647, or check with your base or installation advice nurse, or check in with TRICARE. Thank you for all you do every day for your family and for your country. And let's not forget for yourself. You are really helping to make the world a better place, and we appreciate it. Thank you so much.
Thank you for joining us today.
Good afternoon, everyone. I'm happy to be back with the Military One Source community, continuing CHAMP's Brain Health series. Today we'll be talking about balance as it relates to brain health. My name is Tim Gribbin. I am a senior exercise scientist with the Henry M. Jackson Foundation for the Advancement of Military Medicine in support of the Consortium for Health and Military Performance, or CHAMP. CHAMP is a center of excellence at the Uniformed Services University. What Dr. Chris Zampieri and I will talk about today are our own opinions and do not reflect the official positions or policies of the Uniformed Services University, the DoD, the Henry M. Jackson Foundation, or the National Institutes of Health. Chris, welcome. Could you introduce yourself, please?
Thank you. Hi, everybody. My name is Chris Ampieri. I'm a physical therapist at the NIH Clinical Center. I've been working with research mostly for the past 11 years. And I work in the rehab medicine department. And I have a PhD in rehabilitation science and postdoctoral training in balance.
Thanks, Chris. So today we're going to be talking about balance and brain health. So I bring a little bit of knowledge with my clinical athletic training background, but for most things, I'll defer to Chris, who's really the balance expert out of the two of us. Just a little bit about balance. So it's often perceived as a relatively straightforward task or idea. But it's actually very complex. There's a lot that goes into balance. If we're to talk about poor balance, it's not just due to having, say, weak ankles or weak leg muscles. Chris, can you elaborate on balance a little bit?
Yes, that's correct. So when I talk about balance, I like to compare balance control with a pizza. There are many slices that make up the balance control system, and each slice is responsible for their own thing, but they all have to work together for balance to be working in healthy people. I have a visual that I like to show to illustrate all the different components of balance. And in this visual, you can see a balance control is in the center. We start with sensory strategies. So to control posture, we need to use information from vision, proprioception, which is information that comes from our feet, our joints, our tendon receptors. And we also use information coming from the vestibular system. That's the inner ear. So that's the sensory control of balance. Then there is the movement strategies. We need our muscles to work in coordination to prepare for a weight shift, for example, in anticipation for a movement, a reaching movement, or any tasks really that make us shift our weight. We have the adaptive control. So we, over irregular terrains, we learn how to adapt to it. And that's a separate system, uses a lot of the cerebellum area in our brain. There's the voluntary control of balance. So when we want to bend over or reach for something, we do that purposefully. And there are limits to our ability to get to our the edges of our stability. So that there is a system that controls only that. There's also cognitive control, especially what we call executive control. So our ability to do two things at the same time also impacts our balance. Walking and carrying a tray, for example, or walking and talking, walking, moving our head. Two things at the same time that affect a balance, and most dramatically dynamic balance when we're walking, not so much when we're just standing. Emotional components. So we know that fear, anxiety, and depression all contribute to balance control. Orientation in space. There's a system in our brain that tells us when we are standing or sitting versus when we are laying down. So we have this verticality notion. And then there is the musculoskeletal system, like Tim said, that also contributes to balance control. So we need to have good strength. We need to have good range of motion in our ankles and our lower limbs. And we need to have good muscle tonus. If we have spasticity, for example, that's going to throw balance off.
Yeah, and so poor balance can really be caused by any one of those things or a combination. To give a concrete non-brain example of this, after just a regular musculoskeletal injury, take an ankle sprain, for example. So you roll your ankle playing basketball or running or just tripping over your own feet, as I do. And this will cause a forced stretch of the ankle muscles, the ligaments. As the ankle rolls, the muscles on the side of your leg contract to try and prevent that. But a lot of times it's too late, and that can cause sometimes a muscle strain. This causes damage to the nerve receptors in the skin, the muscles and tendons, and the joint itself. So if we were to go back to, I think, some old treatment strategies, or I would say basic old conventional wisdom, just ankle strengthening exercises aren't going to be enough to restore balance, because it's not just the muscle that has the issue. And we really need targeted treatment to fix the specific deficits. The same can be said when it comes to brain-related balance issues, and commonly after a traumatic brain injury. And this is where Chris can really dig in and talk about more about a TBI's effects on balance.
Exactly. So when we hit our head, the injury could be localized or it could be diffuse. So the problems can be localized in one of those systems or many of those systems that I showed in the previous figure, or it could be interfering with the communication between those systems. And so we need to really, we need a good evaluation to see where the problem is. And we have, and so in TBI, there are different stages, right? Acute and chronic, and TBI can be classified in different categories. Usually a concussion is considered a mild TBI, then there is the moderate and the severe case, and all the diagnosis depends on there's a scale that is used, and it takes into account if you lost consciousness, or if you how long it took you to recover. It takes into account imaging also, if there were any evident disruptions in your brain that can be seen with imaging. But anyway, independent of the level, the severity, from the most mild to the most severe, it could be a combination of problems, and the recovery is always it depends on a lot of factors. And so we're doing a study in the NIH that's been going on for more than 10 years. And we're studying people as they recover from traumatic brain injury. They after they go through the acute phase, which is the first month, when they get to be medically stable, they come to the NIH for evaluations every 6 months. First, we see them at 3 months, then at 6 months, then a year, and then every year after that injury for 5 years, to see how they recover in several different aspects. We measure blood biomarkers, imaging, vocational aspects, cognitive, so their mental function, and balance. So my portion is balance evaluation.
Right. And Chris, I have a question for you. So there are so many different components that make up balance, but there are also very different mechanisms of TBI. So there's, say, like a direct blow to the head through a car accident or contact in sports, getting all the way to the more military specific and blast exposures, either directly from a blast like an IED, or being around, say, artillery pieces. where it's very loud and there's that huge overpressure when the gun goes off. Is there any difference that we typically see in what system is affected based on the mechanism of injury?
Yes. So in the study that I referred to was TBI in general. The injury has to be closed head injury and non-blast exposure. So that's the longitudinal study that has been taken on for the past 10 years. But I've also participated in another study with breachers, so trainers of soldiers who have to breach into places, and so those trainers get exposed to the blast over and over. So we tested them in the chronic phase. So in the literature, just to answer to your question very directly, and then I'll elaborate more. In the literature, we know that right after a blast exposure, it's very likely that you're going to have vestibular system of symptoms. So inner ear gets the impact from the blast, but the blast can be diffuse. So other problems can also happen, but it's classic to find vestibular problems in the acute phase post-blast. Now, what we looked at in this study was the chronic post-blast effects in soldier and breachers that have been exposed to more than 400 blasts. So this is years of exposure. 4 years at least. And in those patients, we found that the vestibular control balance was not so much, it had recovered in most of them. But then what we observed was that the voluntary control balance was more impaired at the chronic phases. And if you remember that chart, the voluntary control balance is what it relates to your ability to move your center of gravity within your limits of support. And when you try to reach for something or when you bend over, and the test that we do, they have to move their center of gravity really quickly. And we noticed that the breachers not only have fell short in their ability or the amount of movement that they could perform, but they also reacted slowly. So there was a reaction time delay in their ability to move their body.
And what's interesting to me about this is it's highlighting a couple of things. One, it isn't a traditional TBI that you might think of. You know, there is no exposure to a traumatic incident like some kind of attack, we'll say. It is in a routine controlled training environment, doing something, just practicing. That is that repeat exposure that's causing issues. Right. And the next is the two different aspects of balance that Chris was talking about, based on where you fall in how often that happens. So in that acute phase, so that short term, it's the vestibular system, versus that long-term drawn out issue is more of a movement control kind of thing. And what that really gets back to, what I mentioned earlier, is that in order to treat these things, the specific deficits need to be identified and specifically treated. And then kind of as a side step to that, or a demonstration of how these treatments are progressing, in these cases, my knowledge is more in the mild TBI, the concussion area. Rest isn't exactly the best treatment anymore. So back in the day, you have a concussion, you get shut down, you maybe get pulled from school if you're in that academic setting, but no physical activity. And really what we're finding now is that's not the best course of action anymore, but things need to be structured. So once you're past that short-term acute phase, you can gradually increase activity, gradually increase educational activities, and that goes also for people in working environments. Just because you're not actively learning, you're still under that cognitive strain of work. And again, that activity should always be specific and structured to the areas that need to be rehabilitated.
Exactly. So yeah, if you think of a vestibular rehabilitation, it's very different from motor control rehabilitation. So in vestibular rehabilitation, they have a lot of dizziness, and their eye movement is associated with the impairment. So there's a lot of exposure, like gradual exposure of head rotation movements in association with your walking, and so you slowly habituate the vestibular system to control balance again. But if the patient doesn't have a vestibular problem, that's not going to help him. So we have to do an evaluation to see where the problem is, and to use that information to guide the therapy. If the problem is with voluntary control, with moving your center of gravity to the edge of support, then we're going to expose the patient to challenging conditions that require them to move and to be more comfortable with that motion. If the problem is reacting to a perturbation, if they're slow to react to perturbation, we're going to expose them to several perturbations, movement of the force plate, or a pullback training, or having them lean on your hands and let go, so that they can adopt that automatic protective strategy again.
Thanks. And this whole area is, I think, really fascinating to me, because so we've just been talking about how injuries can affect balance, but there are also conditions like depression that can affect multitasking skills. So multitasking is when you're performing a physical task and a cognitive task at the same time. So like walking and talking, or working on your computer while having a phone conversation or something like that. Can you expand on how depression and things like that can play a role in balance as well?
Yes, I'm so happy you brought this up, because we tend to think that those are two different things. They are different, but they interact. So in this study that we have been doing for the past 10 years in TBI, following the patient over the years, we were able to select a group of patients that had no other comorbidities that could explain their balance deficit. So it was purely balance deficit due to the TBI, to the traumatic brain injury. And in that group, we separated people who had complaints of balance problems and people who didn't have complaints of balance problems. So it could be that they had a problem that was measurable, but they didn't have, that was not clinically important. They didn't have complaints. So those two groups of people walked on a mat that had pressure sensors, and that capture their gait patterns. And with the gait patterns, we can tell how your balance is, because if you have poor balance, you're going to spend more time with double support, both feet on the floor versus one foot. You're going to walk slower. Your steps are going to be shorter. So there's a lot of parameters that you can measure that explain your balance through gait. So we asked them to walk on that mat and quietly, and then we gave them a mental task and asked them to walk on the mat, counting backwards by threes. And then we compared how much the gait was affected by that dual tasking. I'm gonna tell you where the depression gets in real quick. Just bear with me. So when we compared those two groups, the group that had complaints about balance problems performed worse, was more affected when they had to dual task. Their balance was worse when they had to dual task. Then we noticed that group that had problems, that had complaints, was more depressed than the group that didn't. So depression interferes with your ability also to dual task, and therefore with your balance. So when we, by default, when we take care of depression, we can be also helping other aspects of your life that are not only emotional, that are physical.
And so this ties in really well with my talk last week, where I discussed how physical activity can play a huge role in moderating depression. If you didn't get a chance to watch it, you can look through the Military OneSource archives and pull that up. So I think it really brings this all together of how, you know, staying physically active can help with your depression symptoms if you have them, or be more protective against depression if you don't. But that can also tangentially affect your balance. So, you know, you're not directly doing balance exercises. You're addressing the other aspects of your life that can also play a role. It's just a cool illustration of the total force fitness framework really in action.
Exactly. And how we are mind and body, right?
Yes, that I think that exactly sums it up, how mind and body really interact with each other. Chris, that's really all that I have for our talk on balance and brain health. Do you have anything else to add? Any words of wisdom to throw in at the end here?
I think that pretty much sums it. I just have to thank you and thank Champ for the opportunity to share my work and to contribute to the awareness, you know, related to TBI and balance. And I hope I offered some little advice for people to get checked if you have a problem, get a good evaluation so that the problem can be pinpointed.
Yeah, I think that's a good takeaway from all of this is ask questions. If you're having issues with your balance, say, ask for a more detailed evaluation and see if you can pinpoint those areas that you might have deficits. So that's all we have for you today. Some of my colleagues from CHAMP will be back next week to continue the brain health series. We'll be talking about brain health as it relates to mood and sleep. So thank you again for watching, and take care, everybody.